Knock, knock, knock. Hi.
Hi.
My name is Rachel. I'm going to be your nurse today, okay?
Okay.
I'm going to start with some hand hygiene here. I've provided the patient privacy already by drawing the curtain. I'm doing hand washing per CDC guidelines, 20 seconds. And I'm checking the environment here, making sure everything is safe. The bed is proper height and everything is safe. And I'm looking at the back equipment and everything is all in working order, including our suctioning equipment. Okay, and I'm going to ask you how you are.
I'm good.
Good. And can I take a look at your wrist and look at your wristband? And can you tell me your name and date of birth?
Kara Korn, 031305.
Great, thank you, Kara. Okay, and do you have any allergies?
No.
What?
I do not.
Good. I'm gonna take a listen to your lung sounds, okay?
Okay.
So I'm gonna listen to all the lung sounds. I'm just gonna go through it quickly right now. But just I'm listening to all of them. And they're good and they're clear. And now I'm gonna go ahead and verify the doctor's orders and gather some supplies so that we can take a look at your tracheostomy and do some cleaning, okay?
Okay.
Okay, so I verified the doctor's orders. I've gotten all my supplies ready to go. I've come back. I'm going to do some more hand hygiene, and I'm going to put on some clean gloves, and I'm going to make sure that my patient is well informed. I'm going to tell her about the procedure, everything she needs to know, answer any questions. I'm going to assess for the procedure need and describe the rationale behind that. I'm going to place an absorbent pad underneath my patient and make sure that she's in a good position, semi-Fowler's to high Fowler's position. And I'm going to hyperoxygenate her if needed. Okay, I could do that with a bag, or I can do that with oxygen device. And I'm going to make sure that my suctioning is at 120 or less, and make sure that's on, it's ready to go, and it is. And I'm going to go ahead and I've gotten all my stuff prepared already, and I'm going to be taking my sterile solution. I've washed my hands, and I'm taking my my normal saline. I'm loosening my cap, and this is my sterile container here, and I'm taking it off the cap, and I'm going to be pouring in my normal saline. Okay, so I have done that. It's ready to go, and I have opened my catheter, my suctioning catheter, and I've maintained sterility though. Okay, so it's still sterile. And now I'm going to be opening my sterile gloves and donning those. So I do first glove and okay. So I have my sterile gloves on, and I'm going to wrap my hand around this, okay, and I am going to connect it to my suctioning source, okay, and my left hand has now lost sterility. Okay, that's okay. My right hand is still sterile, and I'm going to be checking the suctioning by placing it in my sterile saline, and okay, and everything's good. And now I'm going to be inserting it in to my tracheostomy in the inner cannula here, and I'm going to be inserting it with my thumb and forefinger, and I'm going to insert it until I meet resistance or the patient coughs. When that happens, I pull back ½ inch, okay? And then I'm going to be suctioning intermittently using my thumb over the catheter vent, and I'm releasing and occluding it, and I'm rotating my catheter, okay? And I do that for 10 to 15 seconds. Now that I'm done with that, I can disconnect. I can disconnect my catheter. I can get rid of that, and I can take out my old fenestrated dressing. And I can get rid of all that and throw that away, and clean up my mess. And I can begin the next step. Okay, the cleaning, and I have set up all my stuff already, and I can go ahead and get my sterile field prepared. So I open my sterile pack, and I do the flap away from my body first, and then on the side, then towards me, maintaining sterility. And now I'm going to put on my first pair of sterile gloves. Okay, so now I'm going to be putting my first pair of gloves on, but I'm just putting the right glove on, and then I can move my items on my sterile field. Okay, so now that those are all prepared, I can get my saline here, and I can sterilely pour it into my separated sterile containers within the tracheostomy kit. So I pour them into different containers, and I can put my second glove on, my left hand, my sterile glove. So I put it on, and I can now begin. And I'm going to begin by taking the inner cannula. I twist it and I take it out, and I am going to place it in my first container here, and I can get my brush, and I can make sure that to clean it really good, going inside and out and around, clean it really good. Okay, when I'm done, I can rinse it off in my second container. And I didn't do this, but I have already pre-moistened my Q-tips and my gauze. So they've been pre-moistened already, okay? So, and now that this is all clean, I can dry it, and I can use pipe cleaners, and I can fold them in half, and I can dry it, and I can go and making sure to just going in one way and out, okay? And I can get my my gauze, my sterile gauze, and I can dry it, making sure that it's very, very dry. Okay, and now I can go ahead and I can hold my face piece in place, and I can put my inner cannula in. So I go ahead and I put that in, and I lock it in place, and we click it, and okay. And now that I've done that, I can go ahead and I can clean the face shield and underneath. So I can take my pre-moistened Q-tips and my pre-moistened gauze, and I can clean the face shield and make sure that I am going from inward to outward cleaning. So from the stoma out, and using circular motions, okay? And I use a few Q-tips to do that, and I'll go underneath now and making sure to go from the inward stoma out, okay? And now that that is all clean, I can go ahead and place my fenestrated dressing. And I will lose sterility when this happens, okay? And I can use my my tweezers when this happens. And I'm simulating. This is my makeshift tracheostomy, so it's not ideal, but you get the point. Okay, so now that we've done that, we can go ahead and we can replace the collar. And I have a new collar here, and I would do that by making sure that this old one is still on, and I can thread this one in there. I can thread this in there, and I can ask the patient if she could please lift up her neck a little bit, and then we come around, go ahead and relax again, and I can put this new one on while the old one's still on. Okay, making sure that it's laying flat, it's not twisted, and it's on, and making sure that it's not too loose, not too tight. You can place 2 fingers, and they're not 3 but 2, and making sure it's good. Okay, so now we are done with the procedure, and we can go ahead and clean up, and I can make sure that the patient is comfortable. Their bed is low and locked, the rails are up, their environment is safe. They have everything they need within reach, their call light is there, and they have everything they need, and I can thank my patient for their time and patience, and wash my hands, and that's it.